ORIE stands for Operations Research and Impact Evaluation, although in fact we do quite a lot more than that. ORIE is implemented by a consortium led by Oxford Policy Management with the London School of Hygiene and Tropical Medicine, the Institute for Development Studies, Save the Children UK, and in Nigeria, Food Basket International and Ahmadu Bello University. We have 7 work streams, and I think it would be useful to give you a bit of an overview of what ORIE does. I won't talk through all of the outputs because we're trying to keep the presentation short, but I think it's good to know at least what the work streams are that ORIE has. These are led by one individual from one of the institutions in the consortium. Firstly, of course, we have operations research, which looks at short-term practical questions around how to improve services that WINN is working on. We also have impact evaluation, a mixed method impact evaluation including quantitative and qualitative methods that has a longer-term learning cycle and an accountability function. We have economic evaluation. So far that's undertaken 3 programme costing studies, but eventually it will produce a cost effectiveness analysis for 2 of the WINN outputs, so CMAM and IYCF, and it will look at just a costing study for the other 2 outputs where WINN is working. There'll be a cohort study of risk factors for stunting in northern Nigeria, which is just beginning. There's a work stream that works on evidence dissemination and uptake, both within Nigeria and internationally. There's also a work stream dealing with the development of capacity in nutrition research in Nigeria through challenge grants, which is just beginning work with two research projects undertaken by northern universities. And finally, there's a gender work stream, which looks at lessons and recommendations for gender issues across all the work streams. It doesn't do any data collection of its own. You can see the website reference where many of the reports are. Our overall outcomes are to produce changes in WINN's design and implementation, and also to contribute changes to positive changes in Nigerian nutrition policy and practice. So that's an overview of ORIE. When we talked about how we should divide up the presentations, we thought it made sense maybe for me to talk a little bit more about some of the challenges from an ORIE perspective. So our first couple of years of work included operations research and the baselines for the impact evaluation, and this identified a number of issues and concerns around some of the key bits of WINN's work. In consultation with WINN, I should say that this is we do work closely. The operations research questions were agreed and discussed with WINN to identify their priorities. So we weren't coming with surprises, we were coming with useful information which WINN and government could respond to. And an example, for example, is on the MNCH weeks, which was the first topic looked at by the operations research work stream. And the main concerns that it identified were around inaccessibility of services and also beneficiary confusion around what services were being delivered and what benefits there were. And that included a lot of confusion with immunisation days and the polio campaign. So the National Primary Healthcare Development Agency and WINN, between them, responded to these things. NPHCDA leads nationally on the MNCH weeks. NPHCDA shared these findings with all states, not just the WINN states. They have national meetings before each of the MNCH weeks. They also reviewed the national guidelines to allow more facilities to provide the services, to try to provide a wider geographical spread of service availability. There was also a review of communications. I know WINN worked a lot on developing more precise messaging and extended the geographical reach of communications activities, both personal, as it were, and national radio communication. And in the WINN states, there's also been a use of outreach teams to extend service delivery. So these are, I think, ways in which we could contribute and WINN and government could respond on a short timescale in quite practical ways to strengthening services. I'll talk about 3 bigger picture challenges that strike us. Ibrahim has made reference to all of them, but strike us, I think, particularly as ORIE in our role. The first one is around data and measurement. So illustratively, this is the percent of children under 5 who are moderately or severely wasted in 5 states, 3 of which are WINNN states, with estimates from 4 different surveys, 2 demographic and health surveys, a mix and a smart survey. And I think there are 2 important points. I mean, the first is the high level of wasting, which is the problem that WINNN is doing something about. The second is the variation in estimates from the different surveys. And at some points, the very high levels of wasting, which the nutritionists amongst us are sceptical, are so high. Some of these are classed, I think, as emergency levels. But the high levels and the differences between the different surveys create these real questions about what's the true level. Yes. And ORIE has done some work looking at the last demographic and health survey that suggests that it's probably overestimating some of the malnutrition rates because of some data quality issues around measuring height and age particularly. And I think it would be useful going forward for us to do more work on this, looking at the different surveys, trying to make an assessment of quality and trying to make a best judgment on what current levels are and what trends are. And that's actually, it's a big job, but I think it's a useful one. The second ongoing challenge, which Ibrahim also made reference to, is around the mobilisation of government resources to deliver services at scale. So I think everybody would recognise there's been a lot of progress at the national level around this draft National Food and Nutrition Policy. There's also a health sector strategic plan for nutrition. In the WINNN states, there are generally functioning committees on food and nutrition and costed nutrition plans, as Ibrahim made reference to, although the scope is sometimes quite variable between different plans. So, and there are some resources being released, and that's important. Nevertheless, there are some serious challenges, I think, around the release of government resources, which in the long term are obviously the key to sustainability. So far, only 1 of the 4 states is releasing resources against a specific nutrition budget line. 3, I think it's 3, are releasing some fairly modest local government funds. The state releases for the MNCH weeks are happening, but they're often ad hoc and insufficient, which creates problems in implementation. And I think reflecting that, MNCH week coverage is still well below target for some of its indicators. So the surveys suggest that less than 30% of children receive vitamin A drops in most of the WINNN states. And referring to the previous slide, that is quite different from the routine data coming from government on vitamin A coverage. Ibrahim, I know WINNN has been doing work to try to improve the quality of the routine data, but it's clearly a big challenge in supporting and implementing programmes. Finally, again, looking at big picture challenges, this is the wider environment in northern Nigeria. Again, Ibrahim made reference to it, but here's some illustrative figures from the ORIE baseline survey. So this is in the particular LGAs where the impact evaluation is being conducted and where ORIE is working. So 40% of households have an unimproved drinking water supply. 87% of mothers have no formal education. 97% need their husband's permission to go to a health facility alone. So the issues around women's ability to act autonomously, the important role that men have in MNCH services being successful is really brought out here. The mean age at first birth is just 17 years, and in the LGAs that we surveyed, only 3% of children 12 to 23 months old were fully vaccinated. So the broader public health and social environment that WINNN and government is operating in to try to improve nutrition are clearly really critical issues. Just to conclude briefly, so WINNN is helping to address some of these serious nutrition challenges in northern Nigeria, and ORIE is pleased to be part of that. And WINNN can point to some significant areas of progress, but there are some wider challenges that I think we need to recognise as government, as WINNN and as DFID, around challenges in the data, challenges in mobilising sufficient resources for scale-up of services, and then in the overall social and public health environment that WINNN is operating in.